Hey everyone, this is your digital chronic illness nurse coach who also is a chronic illness patient. And today we're going to be talking about fibromyalgia and chronic pain. I will share what has worked for me and also some information I have found helpful on my journey to get pain relief while living with this illness. I have found that integrating the pain treatment from Western medicine and also alternative medicine has been the way to go. So what is fibromyalgia? They do not consider it a disease yet. I don't know why, because they cannot identify a cause, but they refer to it as a syndrome, which is a collection of symptoms such as pain, fatigue, tender points on the body, stiffness, numbness, anxiety, and depression. There are many more symptoms of fibromyalgia, but those are the most common. If you are one of the lucky people to be genetically or psychologically predisposed to this disease, then with traumas in adulthood, whether physical or emotional, can trigger the stress response system, which we know as the fight or flight, which then forgets to turn off, leaving your body in this state every single day. No wonder we have chronic fatigue. For the famous artist Frida Kahlo, her fibromyalgia was triggered by a traumatic injury she had from an accident. The pain and horror of living with this disease is beautifully depicted in her artwork. So I am going to address this using my system of the 5 A's. First, address the root cause or possible root causes. 2, we are going to attain the help, resources, support, and education we need to make the changes we want. Assess, make the necessary life adjustments to accommodate the changes financially, mentally, and physically in our life. Action plan, come up with an achievable action plan to help get us to our goal of pain relief or reduction. And awaken. We're going to awaken our why and the reason or purpose to even wanting to release ourselves from the grasp of chronic illness. So let us look into the different medications that can be prescribed for the disease and what you can expect from a Western medicine standpoint that may provide some help. Well, with fibromyalgia, you may have a lower threshold for pain. Experts believe this may result from changes in your nervous system. These changes may cause you to be more sensitive to pain. This could result from wrong levels of neurotransmitters. Neurotransmitters are the chemicals in your brain. This information leads us to drug number 1, Cymbalta. This drug helps to calm down the pain signals by increasing the level of 2 naturally occurring substances called serotonin and norepinephrine. These substances, which are found in the brain and other parts of the nervous system, can affect mood and are believed to help control and suppress feelings of pain. Cymbalta increases the levels of these substances. This process is thought to improve mood and relieve pain in patients with fibromyalgia. Next one is Lyrica or pregabalin. Scientists aren't exactly sure how Lyrica improves fibromyalgia symptoms, but laboratory research suggests Lyrica helps decrease the number of nerve signals and as a result calms down overly sensitive nerve cells. This appears to alleviate pain in patients with fibromyalgia. I have experience with both of these meds and it does help. This next drug I have not tried. It's called Savella. Savella allows more of these neurotransmitters to travel from neuron to neuron. It is not exactly clear how Savella works, but increasing levels of neurotransmitters may ease pain and reduce fatigue or help with memory. We will have to take a systemic approach. And the one big area that I must stress is sleep, and rest. Sleep dysfunction is a key feature of fibromyalgia, and about 70% of patients with the condition say that poor sleep is linked to increased pain. Sleep deprivation can make fibromyalgia's widespread pain and tenderness worse and can also lower a patient's pain threshold. However, painful symptoms can also make it hard for people with fibromyalgia to get enough rest.
This is where the fatigue was kicking my butt.
Okay, so how do we get out of this pain, insomnia, broken sleep cycle nightmare? Well, it is not easy, but it can be achieved over time. I have seen a great reduction in fatigue and pain by addressing my insomnia and developing better sleep hygiene and periods of rest during the day. Let's talk about rest. Rest and sleep are two different things in my book. I see rest as time we set aside to listen to what our bodies are telling us, and then we in turn answer by prompting the brain. We prompt the brain to tell the body, hey, it is time to chill out. Ways we can prompt the body to use the parts of our brain that control stress is by using our same body to send reminders to that area that it is safe and it can relax. How? Well, glad you asked. Just saying that relax might even make people anxious, so just using words alone does not really help. You have to do some action that shows the brain that it's time to rest. Something as simple as deep breathing. Gentle exercises like Tai Chi and stretching, swimming also allow 48 hours of rest in between any type of workout. For me, prayer, worship, sitting to meditate, time with God allows me to give my cares to a higher power. I also use transdermal magnesium rub on the bottom of my feet before I go to bed. I do it sometimes. And I also have magnesium in my electrolytes that I drink in my water. There are things like flotation tanks. I've never tried that before, but they look great. Find hobbies that give you joy and act like a distraction. Also, now we have a manual therapies, myofascial release. Whether done by someone or by yourself, I use a foam roller and a massage ball and follow helpful YouTube videos by physical therapists. We will talk a little bit more about this later on in the video. There's also something called a cranial cradle. The cranial cradle is a home therapy cushion that's designed to relieve pain and dysfunction in the body using concentrated pressure and is intended to feel and function like a therapist's hand. There's also this thing called biofeedback therapy. Biofeedback therapy, also known as biofeedback, is a mind-body technique that uses non-invasive equipment to help people learn to control involuntary bodily functions. Next one is very popular. Acupuncture is a technique in which practitioners insert fine needles into the skin. Now, let us address sleep. First thing we're going to do, we are going to evaluate our medication list and see if there are any medications that need to be taken earlier in the day so they do not disrupt our sleep. Ask your doctor for a sleep study to rule out any sleep disorders, sleep apnea, or snoring issues that may be causing your airway to be affected during the night. Get medications that promote sleep. I use this and it has been helpful. Ask for extended release medications that have the least amount of side effects for you. You can decide on this with your doctor. Or you can use natural supplements that promote sleep. It's up to you. But getting something to help you break that sleep cycle so you can get into a rhythm is necessary. A question to ask is, do I have restless leg syndrome? Restless leg syndrome, or RLS, is a chronic neurological disorder that causes an intense urge to move the legs, often accompanied by an unpleasant feeling. Symptoms usually occur in the late afternoon or evening and are often more intense at night when resting, and that needs to be brought up to your doctor. We also need to work on
brain fog.
We also need to work on our mental health. Work on your emotions and traumas by doing shadow work, therapies like EMDR therapy, which is eye movement desensitization and reprocessing. You also have DBT therapy, dialectical behavior therapy. DBT is a structured psychotherapy program that helps people manage intense emotions and which I find to be most effective. And I've heard good things about EMDR. This helps with the root cause of trauma, nightmares, and flashbacks. I have tried DBT and currently doing DBT, and I can say it has helped me on this journey. This helps with the root cause of finding the root cause of trauma, nightmares, flashbacks, things that just disrupt your sleep. You also need emotional support to deal with the harsh pressures of this disease. It can be a good idea to take medication, as I said before, supplements, whichever route you choose, to help with anxiety and depression so you have the wherewithal to deal with these emotions and work your way into a place where you may not even need meds anymore. This gives you the safety net you need to use the time to start and develop healthy coping skills and the mental fortitude that can help you get through daily life, living with a chronic illness. I think all of these things need to be addressed first before we start creating a sleep hygiene routine, or else it is just going to get disrupted and then you feel like you cannot be consistent when that is not necessarily the case. You just have too many things unaddressed. Now we have attained and addressed some important things. Now we move into adjustments, action plans, and the awakening portion. Now we can talk about sleep hygiene and building a routine. So things like no caffeine after 2 p.m., drink herbal teas, non-caffeinated teas, teas such as golden milk, lavender, chamomile, ginger, milk thistle, dandelion root, cinnamon, and peppermint tea before bed. Go to bed at the same time every night and try to wake up at the same time every morning. Get at least 7 to 8 hours of sleep. If you can reduce daytime napping, I know that is hard when you have fatigue, but it would help. Create a relaxing bedroom atmosphere. Time to create a nice vibe in your atmosphere. It may be time to do some redecorating, time for some aromatherapy, get some essential oils and a diffuser, get some light blocking curtains, comfortable pillows. They even have the masks nowadays that you have Bluetooth, the sleeping mask that has like a Bluetooth feature to it. I'll list all of these things down below in the description area. You may need a firmer mattress. A firmer mattress is more comfortable for me, but you may need a new mattress, whatever is comfortable for you. And having a mattress with an adjustable remote is very helpful. But if you are not able to afford that, getting a memory foam mattress topper is also helpful. Now, let us talk about the fascia. This is important. The fascia, this is a major source of pain relief for me, and I believe it will be for you too. Surgeons used to think that the fascia is a tissue that just covers the organs and muscles and bones. Now, the medical world has expanded the definition to include tissue that surrounds all the cells, nerves, joints, tendons, and ligaments in your body. When fascia gets stressed, it tightens up. Like your tendons and ligaments, fascia is mostly made up of collagen. There are several ways to release tight fascia. Foam rolling, a form of self-massage that involves rolling a hard foam cylinder over your body to release tension. Heat therapy, applying heat to sore muscles can help relax the fascia, which can improve range of motion and reduce muscle pain. You can try taking a warm bath or shower or using a heating pad or a heated blanket. Massage therapy targets trigger points in the body to help relieve pain and tension and can also increase blood flow to muscle fibers, which can improve fascia elasticity. Body work massage is different than regular deep tissue massage. Body work encompasses all soft tissue, muscles, tendons, and primary focus on the connective tissue known as the fascia. Think of bodyworks massage as a holistic approach to manual therapy, with deep tissue massage as just one technique within their toolkit. The main goal of bodywork primarily focuses on comprehensive fascial restoration. Unhealthy fascia is often the root of aches and pains, and body workers address these issues strategically to restore tissue health. This holistic approach is supported by the National Center for Complementary and Integrative Health. You can do gentle stretching. You can try stretching your skin in different directions and holding the stretch for a few moments. Then we have physical therapy. Physical therapists can provide body work exercises that can help with back pain and other soreness related to tight fascia. And I will try and get the information for different bodywork specialists around the US and link them in the description below if you are interested. Now we have acupuncture. Acupuncturists can target pain points by placing needles in fascial tissue. So now, there's a lot of talk surrounding the gut. So we can't do this without not mentioning the gut. So when we're dealing with the gut, we need to decrease processed food and processed sweets and start eating a nutrient-dense diet filled with whole foods. Drink at least half your body weight in water with some good low sugar electrolytes that have some good salts in them. Take supplements to help the gut. Supplements I take are L-glutamine, probiotics, digestive enzymes, bone broth soup, yogurt, herbal teas, and multivitamins that have vitamin D3 and zinc. Take a B complex vitamin as well. I also do a B12 drop, but the most effective way that I find I get the benefits of B12 is doing vitamin IV drips. So if you find yourself with a little extra money, I do recommend getting vitamin IV drips. And now we are on to the awakening. Living with fibromyalgia can feel like a day job, and so remembering your reason or finding a purposeful reason to get up each day and keep going will make this road not as dark and lonely. Remember your why for living, or create a new one if the last one expired. I hope you found this video helpful. If so, check out the rest of the videos that I have on the channel. There might be a video suggestion popping up. Do not let chronic illness clip your wings. You can soar above the harsh weathers of chronic illness. If you found value in this video, please like, subscribe, share, and also talk to me in the comment section and let me know what you would like to see and how this video helped you.